Hi everyone, let's talk about Cushing syndrome, Cushing disease, which is adrenal cortex disorder. In Cushing syndrome, everything goes high. All the vital signs, all the electrolyte goes high, except calcium and potassium, which is hypokalemia and hypocalcemia. These two electrolytes goes low in Cushing syndrome, but in Addison disease, it goes high. The two electrolytes, potassium and calcium, goes high in Addison disease, but in Cushing syndrome, the both of them goes low. Let's talk about clinical manifestation of Cushing syndrome, that is Cushing disease. There will be a generalized muscle wasting and weakness. And a client suffering from Cushing syndrome will have moon face, and we have buffalo hump. In Cushing syndrome, there will be truncal obesity with thin extremity. If you see a patient suffering from Cushing syndrome, from waist up will be obesity, and the lower extremities will be very thin. They have thin extremity and obese upper trunk. In a patient suffering from Cushing syndrome, they always have supraclavicular fat pad, and weight gain. Remember, in Cushing syndrome, all the electrolytes is in the high side except potassium and calcium. So a patient suffering from Cushing syndrome, they have hyperglycemia, hypernatremia, hypertension. They have hypocalcemia and hypokalemia. This is very important in Nclextips. Nclextips, we like to ask you some questions based on electrolytes. But if you can remember that in Cushing syndrome, all the electrolytes goes up except calcium and potassium. This is very important in Nclextips. A patient suffering from Cushing syndrome, their skin is very fragile. They are easily bruised. That's why they have bleeding tendency, and they are prone to infection. A patient suffering from Cushing syndrome have reddish purple striae on the abdomen and the upper thigh. This is a great question. So as a nurse, you must monitor vital signs, especially the blood pressure, monitor the intake and output, monitor the weight gain, monitor electrolyte level, especially calcium and potassium. Watch out for bleeding, because patient has a bleeding tendency because the skin is so fragile. Then watch out for infection, because the patient is prone to infection. I think I will stop here for now. Awareness is the key. Do not get it twisted. You know what to do for me? Check this information out. Remember, you can, you will, and you must pass your Nclextips exam. I wish you all the best. Thank you. Bye. I love you all.